I'm Dr. Casey Jones, and today I'm going to talk with you about what happens if you have a tooth knocked out. Basically, it is possible for a tooth to get knocked completely out. And so if that were to happen, it doesn't quite look like this. It looks a little bit more like this. There is this part of the tooth, which we call the crown, and that's what you can see as you smile. And then this part of the tooth is the root of the tooth. And that's what's under the gums that should be in there, but now this whole tooth got knocked out of your mouth. So number one, what you would want to do is you want to find this tooth, okay? Because teeth are the only thing in the body that can't repair themselves. And if we can get this tooth back in, there's a chance that you could at least have it in there for a while, okay? So you are gonna search for this tooth, find the tooth, and try to pick it up by the crown part. So that is the part that you see when you smile. Pick it up by the crown. Try not to touch the root as much as you possibly can, because there's all these fibers on it, which are periodontal ligament, that help that heal if we're able to get it back into what we call the socket, which is the part that's missing that tooth. So it'd be right in there. So we're gonna try to get it back into there. So now you found this, you are going to, I don't even care if it was in the dirt, doesn't matter what, you are going to very gently rinse off any big specks of dirt or whatever with some water, okay? Saline, if you have it, is even better. And then you are going to try, if you can, to put this back in. So in order to do that, you are going to have this tooth by the crown part. So remember, this would look a little pointier. And you are going to take that, and you're going to, this is your own mouth, and you are going to take the part that looks like the front of the tooth. So the front is usually flat. The back usually has kind of bumps on it and stuff. So they look a little different. Try to picture your mouth, and you're going to try to put that back in there. Okay? And once you have it back in there, you're going to take a handkerchief, gauze, something that you can bite down on to try to keep that pressure, to keep it in place, and you're going to get to your dentist as fast as you can. Okay? If you can't do that, if that freaks you out, if you just don't have anyone around or whatever, then go ahead and take the tooth and put it in either Hank's Balancing Solution, which you can get online. You can do Save a Tooth, and that has special little compartments in it where you can put the tooth, which is actually pretty awesome, so that then when the dentist takes it out, it's even easier for them not to touch the root of the tooth. You can also put it in milk. You can put it in saline. You can put it in your own mouth. So you can put it right here. You just gotta be careful you don't swallow it. Basically, we don't want to put it in just water because that will damage the tooth. What I'm talking about today is adult teeth. So if a baby tooth comes out, so most likely that's going to be someone who's less than, let's say, 6. These teeth are probably going to come in on average around age 8, but some kids are early, some are late. If it is a baby tooth, you do not want to put it back in the mouth. You could damage the permanent tooth underneath. You do want to put it under the pillow for the tooth fairy, but you do not want to put it back in the mouth. If it's a young kid, it's even more important that you get it in that mouth. Well, it's important either way, but you want to get it back in there because there are other things that we can do to replace the tooth these days, but none of them really last as long as that child's life is going to be. And so hopefully we are able to keep that tooth in there as long as possible. And because teeth are the only thing in our body that can't repair themselves, there's gonna be other complications along the way. So when you have trauma to a tooth, the tooth coming out is probably the most terrifying one, because who wants to see that? But other things can happen too, as far as the tooth can break. It can break diagonally, it can be bumped, it can move. So all these things are different things that can happen, and it really should be that you see a dentist as soon as you can versus waiting until you finish the game or waiting weeks or what have you. Might as well get some opinion on what it is that needs to be done. And there is an app that you can get for free and have it on your phone in case any of these things happen to you or your child, and that will just help, because the more that we can save teeth, the better, right? Thank you. Have a great day, and don't forget to smile and dance.